My name is Dr. Ailsa Niven and I am one of the Programme Directors on the MSc Physical Activity for Health at the University of Edinburgh. The purpose of this short video is to provide some background information on our MSc programme for potential applicants. Why study physical activity for health at postgraduate level? There is considerable increase in both research and practice to address the insufficient physical activity levels in our society. Insufficient physical activity is a key risk factor for premature mortality, and therefore its importance has been increasingly recognised. Just last year, the World Health Organization reiterated that the physical inactivity levels are at pandemic level and physical inactivity is a global public health issue. As a consequence, there is a growing workforce dedicated to improving global physical activity, and this master's programme will help provide skills and knowledge to support you in making an active contribution to this workforce. So why study at the University of Edinburgh? The University of Edinburgh is a world-renowned university that consistently ranks in the top 50 in the world. As would be expected of a world-class university, there's facilities available to support your studies and your extracurricular activities are outstanding. The Physical Activity for Health programme is directed and taught by members of our Physical Activity for Health Research Centre. And our research centre involves colleagues who are actively undertaking research that is world-leading in a number of physical activity areas. Professor Nanette Mutri leads our Physical Activity for Health Research Centre, and we use the knowledge that we gain from our research activities to inform the teaching that we deliver to our students, meaning that students are gaining cutting-edge knowledge reflecting the most current research. And we encourage all our MSc students to get involved in the Physical Activity for Health Research Centre, and we invite you to come along and engage in our weekly meetings, as well as look to engage in opportunities to undertake research that is going on. And become a member of PARC. So what does our programme involve? We draw from the health sciences of psychology, physiology and epidemiology to enhance knowledge and understanding relating to physical activity for health. We have 4 core courses around physical activity for health, and these are delivered across the first 2 semesters of the programme. In semester 1, we deliver Physical Activity for Health, which is a core course and aims to demonstrate the link between physical activity and chronic health conditions. In semester 1, we also deliver the Psychology of Physical Activity, which provides an overview of the research showing that psychological factors can influence physical activity levels, and also how physical activity can influence psychological outcomes. In semester 1, we also deliver assessment of physical activity and body composition, and this is a very practical course where students are encouraged to engage with and evaluate different methods of assessing physical activity, and also the key health indicator of body composition. In semester 2, our Physical Activity for Health across the lifespan looks in more detail at physical activity issues for individuals at different life stages. Our Physical Activity for Health courses are underpinned and supported by 2 key research courses. In semester 1, the key research course of Understanding Research Concepts is delivered to introduce individuals to research concepts that will inform and underpin their understanding of the material that they cover in the other courses. And in semester 2, we have a research process course, which is the main course to prepare individuals for their dissertation, and the assignment for this course is a research proposal for the dissertation. And the dissertation is the culmination of the studies, and although it says here that it's delivered across the full year, we do encourage students to be thinking about their dissertation throughout the year, but the main work is undertaken from April to August. And in the dissertation, students undertake an independent project around an area that is of interest to themselves, supervised by one of our experts in the Physical Activity for Health Research Centre. One of the unique aspects of our programme that we think is attractive is the opportunity to undertake optional courses. Optional courses can be taken from across the university, providing flexibility in the material that students study. So we have 40 credits of optional courses, and typically that's made up of 2 20-credit courses, or potentially 1 20-credit and 2 10-credit courses. And here there's an example of some of the courses our students have taken previously from within our own School of Education and Sport, but also across the university. So for example, there's courses from the Masters of Public Health that students can opt to take. In terms of when we deliver our courses, we've organised our programme so that the core courses are delivered on a Monday and Tuesday, and we also make use of evening delivery. This timetabling is intentional so that students can also engage in other activities throughout the week, and that we have a dedicated time where our master's students are on campus. And of course, this provides some flexibility for people who would like to study on a part-time basis. The optional courses do vary, but individuals can choose courses based on their individual requirements to fit their own timetables. We are very proud of our programme, and we have been fortunate to have some fabulous students who have graduated and gone on to a number of different activities. Our students have given us lots of helpful and useful feedback relating to our programme, some of which is illustrated here. And please do follow the link for some student testimonials that provide a bit more insight into students who have studied our programme and what they've gone on to do. In terms of potential careers, there is a growth in the workforce focusing on physical activity. Individuals may find roles within health promotion, within primary care, the health and fitness industry, physical activity development, consultancy, and within postgraduate research. Several of our own graduates have gone on to PhD study. If you're interested in our programme, then our entry requirements are normally a 2-1 in a relevant discipline, but please do get in touch if you're interested and you don't fulfil that criteria, because we certainly are open to considering other experience that has relevance and helps to contribute to a dynamic learning environment. So please follow the link to the application material on the next slide, and if you would like to get in touch to ask any questions, then please do feel free to get in touch with either myself, Dr. Ailsa Niven, or my colleague, Dr. Sam Faulkner. And the link here will take you to the application process. Thank you for your attention. If you have any questions, then please do get in touch, and we look forward to hearing from you soon.